I get to work with a lot of patients who have already worked with other vestibular healthcare providers, such as vestibular physical therapists, vestibular physicians like neurotologists and otoneurologists, and physician assistants or nurse practitioners that work as physician extenders in these type of specialty practices, and even some neurological chiropractors. Sometimes these patients have seen more than one of each of these types of vestibular providers before they get to me. These providers are good. They actually have knowledge and training on how to treat classic traditional vestibular problems, such as traditional posterior canal BPPV or vestibular hypofunction. Some of these patients I work with tell me they've gotten extremely dizzy during BPPV testing with other vestibular providers, but then they were not treated for BPPV because the provider told them they actually ruled it out during testing. Other patients have actually gone through a full course of vestibular rehab, maybe doing upwards of 20, 25, even 40 physical therapy visits with a vestibular rehab provider, such as a neurological chiropractor or a vestibular physical therapist. In many cases, the patient has reported that they have not gotten relief, or maybe they've only gotten partial relief, and then they end up working with me as a last resort. So therefore, when I see these patients, I'm alert to the possibility that they may have the most common type of vestibular vertigo that even healthcare providers who are trained in treating the vestibular system often miss. In this video, I will describe the vestibular problems I commonly find that are overlooked even by vestibular healthcare providers and how these 3 problems get missed. I'll try to provide some context as to how this happens, along with clues to help you get your life back. I'm the Vertigo Detective Kim Bell, and this is a reminder that this channel exists to provide information, education, and hope. It is not individual medical advice. Now let's get into it. Be sure you stay into the end of the video so I can share with you another YouTube video I made with related content I won't have time to include in this video. The most overlooked cause of vestibular vertigo that other healthcare providers who are trained in assessing the vestibular system often miss are atypical vertigo, which in my opinion are widespread, mild crystals loose in the ears. So this is crystals that are loose in the right and or left ear. It's usually both ears in cases I see, but it can just be one ear. And then the crystals have over time spread out into multiple locations within the inner ear so that they're not producing a violent spinning vertigo that's really obvious, but they're producing more mild motion activated symptoms such as dizziness, spaciness, fogginess, nausea, feelings of falling during certain head motions and head positions that last for seconds to a minute or two, but they're not the classic spinning vertigo. And in those cases, the nystagmus, which is the involuntary eye movement present during BPPV testing, may be either absent, as in a type 2 BPPV case, or it may be so quick and mild or subtle that it doesn't get picked up on a camera. Those are the reasons why these widespread mild BPPV cases are often missed even by vestibular providers. They're trained to look for that vigorous, obvious, strongly beating, robust positional nystagmus when they do the BPPV testing. And if the nystagmus is either absent, as in the case of a type 2 BPPV, or if the nystagmus is very subtle and quick, short-lived, transient, they might miss it even with a camera. So those are the reasons why I think the widespread mild BPPV gets missed. I call that atypical vertigo, and it can be treated to resolution with BPPV maneuvers. So in those cases, though, unfortunately, they take a higher number of visits. Sort of like the analogy I give to my patients is it's sort of like if you track in dirt or sand into your home, if you only have that dirt or sand in one room, it's easier to clean it up. But if you tracked it into a few rooms within the home, it may take more time and effort to clean up all the sand, okay? So in a sense, you can think of it as particles that are spread out in more locations within one or both ears, thereby producing motion-activated symptoms that are more mild and subtle and not the classic robust BPPV that vestibular healthcare providers are trained to look for. The second most overlooked cause of vestibular vertigo that is often missed even by vestibular providers is horizontal canal BPPV. In fact, I just recently saw a patient who had been to an ear, nose, and throat doctor as well as 2 other vestibular physical therapists to get tested for BPPV, and she told me, quote unquote, they ruled it out. But how did they rule it out? Well, they only put her in the testing position for the posterior canal, which is called the Dix-Hallpike position. They put her in that position, which is most sensitive to crystals that are loose in the posterior canal. And even though she did get a little dizzy, they didn't see any nystagmus, nothing really obvious. And so they said they had ruled out BPPV and they did not provide any treatment or additional testing in other positions. Sometimes horizontal canal BPPV can show up during a Dix-Hallpike test for the posterior canal. And that can be the case in some cases, but it doesn't always happen that way. Sometimes horizontal canal BPPV will only show up if you do the specific test for the horizontal canal, which is called the roll test. And in this case, and in many cases, even vestibular providers are skipping over that test and they're not doing it. And therefore, if the horizontal canal BPPV did not show up during the Dix-Hallpike test for the posterior canal, that's the standard test for the posterior canal, and the provider does not also do a set of roll tests to check the horizontal canal, then that type of BPPV is getting missed in a lot of cases. The third type of vestibular vertigo that is often missed even by trained and skilled vestibular providers is anterior canal BPPV. Why is that? Well, because anterior canal BPPV cannot occur physiologically on its own spontaneously. Okay, so if someone just wakes up with vertigo in the middle of the night or first thing in the morning with a spontaneous onset of BPPV, then the crystals could be in the posterior canal or they could be in the horizontal canal. But they can definitely not be in the anterior canal. The way I think of the anterior canal and the way you can picture it is it's sort of like a loft where you would actually have to climb up a ladder or climb up a flight of stairs to get up into the anterior canal. And as long as the person is just sitting up or lying down in their bed and getting back up, the crystals are never going to get up into the loft, so to speak, or the anterior canal. The crystals, BPPV crystals, can get up into the anterior canal if there's an accident, like a trauma. So there has to be enough force to propel the crystals upward and over the angle that they have to traverse to get into the anterior canal. So think of like if you just threw a ball up in the air, it would just come right back down where it started. But if you threw a ball up in the air and forward, then it could fly up into a loft within a room. Okay, so it has to be that type of a trajectory of the crystals during a trauma, such as like a concussion or a rollover car accident or something like that, that the crystals can then be flung up into the anterior canal during a trauma. The second way that I see crystals end up in this anterior canal is through what we call a canal conversion, meaning the patient had crystals already loose somewhere, most likely their posterior canal statistically, and they were trying to ignore it or live with it, and they were, say, blow drying their hair. And so they flipped their head upside down to shake their head around and blow dry their hair upside down, and then they got super dizzy after that. Well, the crystals may have converted during that activity from the posterior canal into the anterior canal. So there has to be some kind of an upside down head motion after vertigo has already started, so that they already have BPPV and they're living with the BPPV. They have loose crystals somewhere in their inner ear, and then they flip their head upside down to do some kind of an activity, and then the crystals convert into the anterior canal while their head is upside down. So other examples besides blow drying the hair would be applying a towel on your head when you have wet hair, when you step out of the shower. Another example would be doing backflips in a pool. Another example are people I treat that are very active. So they're gymnasts, they're doing jujitsu or other martial arts where they're rolling around on the ground. They're doing yoga and they're going upside down, doing headstands and handstands and downward dogs and all kinds of yoga poses that cause them to drop their head down. And then they may have an opportunity to convert existing BPPV particles from the posterior canal into the anterior canal. And now, why is that getting missed? Well, because many younger clinicians don't even know about anterior canal BPPV, because when the American Academy of Otolaryngologists, these are ear, nose, and throat doctors in the US, when they revised the BPPV clinical practice guidelines, I believe that was in 2017, they actually removed anterior canal BPPV from their revised clinical practice guidelines because they're saying they doubt if this condition even really exists. Anterior canal BPPV was in the clinical practice guidelines I read when I first started treating dizziness in 2006. But when they revised the guidelines in 2017, they removed it. And so the newer clinicians, the younger clinicians, they're just reading the newly revised clinical practice guidelines as they get started learning how to treat BPPV. And they're reading that anterior canal BPPV most likely does not exist. And therefore, they're not even looking for it. And that's why so many patients that I treat who have already gone to other vestibular providers who are very skilled, very knowledgeable, and know how to test for traditional BPPV and things like vestibular hypofunction have overlooked the widespread, mild, atypical crystals. They have overlooked the horizontal canal, and maybe they've overlooked the anterior canal. So those are the top 3 most overlooked causes of vestibular vertigo, often missed even by trained and skilled vestibular providers. Now make sure you check out this next video so you can look at the 5 variants of posterior canal BPPV that are often missed.